And Colorado has to do with the topic today that I'm going to be talking about. There's planes flying over this morning, so I hope it doesn't disrupt the audio too much every time they change their flight patterns. So modern living. So Colorado, I think it was last year, it was the last voting year, it was 2024. They voted in a new position in veterinary medicine. Now, veterinary medicine is regulated. There's a national veterinary association, which is the AVMA, the American Veterinary Medical Association, which is very similar to the AMA. They lobby in Washington, they set a lot of guidelines, and yeah, there's probably lobbyists coming from corporate and big pharma to the AVMA. The AVMA tends to be a little stodgy. There's more women in there now, but tends to be a little stodgy. Then every state, individual state, has what's called their State Practice Act. And they set their own legislation for the state. So they determine how to in order to practice veterinary medicine, you have to be licensed in the state you're practicing in. So if I decide to move, I have to get a license in the state I'm moving to. So the state, like FVMA, is the State of Florida Veterinary Medical Association. So in Colorado last year, they voted in this mid-level veterinary position. So it's kind of like a lot of people are saying, well, it's like a PA, it's like a physician's assistant. And when physicians came out, a lot of people were kind of excited. I talked to people personally and they're like, my PA knows more than my MD and they spend more time with me and things like that. Well, they're trying to do the same thing in veterinary medicine, to have a veterinary professional associate, a VPA, and it passed in Colorado. Now, in my mind, there's a lot of issues with this. They say there's a veterinary shortage, but what I am seeing is they started teaching medicine much differently. Soon after I graduated, it was probably already coming in while I was still in vet school. So what they did was when corporate started buying it out and insurance companies came in, they wanted to make money. And so they were teaching vets the gold standard of care. You have to get people to take the gold standard of care. There's no other options. If you come in for something, you need the full blood work, you need the full x-rays, you need a CT scan, you need an MRI. If it's a specialty thing and you're a general practitioner, you send them to the specialists. And so in a lot of ways, the general practitioners are not being trained anymore how to handle certain conditions and certain health problems. They literally, I don't think they're even training them. They're saying, oh, if it's neurology, send them to the neurologist. Now, if we had a back and it wasn't fully paralyzed, we would medically manage that case. And then there were certain lines that were crossed that were like, okay, we need more than medical management. Yeah, you need to go to the neurologist for surgery. So I learned, and then what happened is people are getting in there, the system's getting log jammed up. You walk into a veterinary clinic and you have a simple problem like an abscess, and the GP on the scene doesn't know how to fix it. So they've got to call in the surgical team or the medical team. This happened recently to a case of mine. Well, we have to wait for the surgical team to show up, which is going to be in 2 or 3 days. They're going to want to get a CT scan. Where in my day and age of practice, oh, it's an abscess. You know what? We can schedule you for either leave them with us today and it'll be about a 20-minute procedure and we'll take care of it, or bring them in tomorrow and it'll be about a 20-minute procedure and we'll sedate the animal, clean it up, lance it, put it on antibiotics, do what we need to do and get it back home to you. Well, now, no, it's become this much more involved issue. And so nobody can get care and everybody's backed up and there's not enough specialists. I see specialists now. I've seen oncologists that are just, instead of actually staging a cancer case, they're like, well, we assume it's this cancer and this is the chemo protocol we'd use, so let's do it, even though they don't even have definitive evidence of what kind of cancer it is. So it's become an issue. So now they're backpedaling, and they're going back to what they are calling spectrum of care. And spectrum of care is the veterinary medicine that I learned how to practice back in the mid-90s and before that. So what spectrum of care is where you have the animal and the client in front of you, and you discuss with them, okay, these are the signs and symptoms your animal's having. We can start out doing blood work and see what that tells us. If the blood work tells us we need x-rays, then we'll go on to do x-rays. If the blood work tells us we need a medication, then we'll go on and do a medication. If the blood work tells us we need to go to a specialist. So it's a different type of, we start out with one diagnostic and then move forward from there depending upon what we find, instead of doing all the $3,000 worth of diagnostics all at once and then try to figure out what's going on. So the whole industry and schools are, I'm noticing it in my medical journals, they're backpedaling to go back to spectrum of care. Now, I get a message this week from the Florida VMA, and the Florida VMA, and there is a bill that has already, I believe, passed the legislature, because this notice I see on their website I'm looking at right now came out in 2025. And it states that the Florida VMA strongly opposes this bill, which seeks to establish a mid-level practitioner position known as a veterinary professional associate. So they think this is going to take the load off the veterinarians. So it would be somewhere between a veterinarian and between a technician. So the Florida VMA argues that this position poses significant risks to patient safety and well-being, as VPAs would be considered equivalent to a doctor of veterinary medicine, while receiving substantially less education and clinical training than licensed veterinarians. And I'm telling you right now, if they get any less clinical training than the young veterinarians that I'm seeing out there right now, they might not as well even call themselves veterinary professionals in any way, shape, or form, because there's some big problems we're having. In comparison, both veterinarians and VPAs would usually complete a 4-year undergraduate college degree. However, according to the only existing state VPA program in Colorado, VPAs would then only be required to complete 5 semesters of additional veterinary education. Now that's there's usually 4 semesters a year, so it would be 5 semesters. 3 of those semesters are fully online learning. So somebody's sitting in their living room in front of the computer. One semester consists of in-person laboratory training, and the final semester is a clinical internship. So 3 months, 1 semester is a clinical internship. This contrasts sharply with a doctoral veterinary education and training program, which requires an additional 4 years of veterinary medical training, including significantly more hands-on surgical and diagnostic training with live animals and cadavers in a laboratory setting. Furthermore, despite VPAs having overlapping responsibilities with veterinarians, they would not be legally allowed to prescribe medication, which could lead to treatment delays and unnecessary suffering for animals. Additionally, there is no evidence to support claims that VPAs would enhance access to care or reduce medical costs for pet owners. For these reasons, the FVMA is actively urging policymakers to reject this legislation in favor of strengthening existing veterinary care teams. In response to the VPA bill, the Florida VMA strongly supports a bill which seeks to establish licensure for veterinary technicians in Florida. Veterinary technicians already hold an established and essential role in veterinary practices, contributing greatly to productivity and efficiency within the veterinary practice. The legislation would help align state standards with those of the rest of the country, as 44 other states already have licensing requirements in place. Under this bill, licensed technicians would be authorized to conduct routine health examinations, administer rabies vaccinations, and assist in expanding access to veterinary care. So here's the point. They're saying our veterinary technicians are already in place, and if we set up a licensing program for them with more training, they can already build on the training that they already have and the things that they are already doing. Instead of bringing in someone who only has 5 semesters worth of schooling, and then they actually state that they can perform, that they can diagnose, prescribe in the bill, and perform certain surgical procedures as long as they're under the supervision of a veterinarian. Now, I don't know about you, but I don't want somebody performing surgery on any of my family members, whether they're animals or humans, unless they have been trained to perform surgery. I got extensive training in surgery because not only did I go to veterinary school and I was on orthopedic and soft tissue surgery rounds where we were spending hours, you know, and it wasn't an 8-hour day on surgical rotations. It was more like 12 to 14-hour to 16-hour days where we were either getting ready, diagnosing animals, getting them prepared to go into surgery, or standing at that surgery table assisting in surgeries. Also, we spent our entire first semester in veterinary school, an entire semester, dissecting a dog. And then the second semester, we spent an entire semester dissecting a cow, a horse. Actually, we could choose between a horse or a cow, small ones. And so we got to know, we literally went from the skin, peeling every single layer, every single nerve, all the major arteries and veins, all the organs, all the bones, all the connective tissue with our own hands. And that's a much different experience. And I think without having that going into surgery, you can run into all kinds of problems. Plus, my first year out of vet school, I got a job at an animal shelter in New Mexico, and I was pretty much the go-to veterinarian in this little tiny small town. And I stood at that surgery table, did 30 surgeries a day for over a year. And when I'd open up a dog to spay them, half the time I didn't know what I was going to be finding, but it gave me an extraordinarily great amount of surgical experience. Now, that would be one way to train them, put them in animal shelters and have them doing spay and neuter, but they're not even talking about that. I don't think your regular veterinarian even has that kind of experience or could handle doing that in honestly, from what I am seeing in terms of the cases coming to me these days. That's why I'm doing a WTF moment on Substack for the weekly what is going on with our profession moment. So I think the public, you guys really need to hear about this. Um, so that, and I honestly, I do believe it's already passed. I think they made some changes, but as far as I know, I think it's 5 semesters worth of training. So when you go into a veterinary clinic and you hear the fancy title, veterinary professional associate, you need to understand that that person may not even have as much experience as the vet tech who's been working alongside that veterinarian for 5 to 10 years. And I would demand to see a actual DVM, Doctor of Veterinary Medicine, over a VPA. I just don't. I think this is going to cause more problems instead of less problems. Um, there was something else I was going to say, and I lost track. So, anyways, that's the next big step in the meltdown of veterinary medicine, and it's sad. I'm actually, I never thought I'd be saying this, but I'm actually happy that I'm at the end of my career. But every week I am available for online consults, and a lot of my online consults are just having people doing record reviews, having them send me all the diagnostic results. Buddy, stop, please. Having them send me all the diagnostic results, and then I go through and find out, do they really have a diagnosis? What is this diagnosis based on? What are they doing in terms of treatment? And tell them to go back and say, ask them to run this test and this test. Let's see what's going on here. And then I can also do things like get them on a better diet, because if you do not have if the dog does not is not on a good enough diet, they will not be able to heal their own body. If they are receiving the necessary treatments, then they can heal their own body and come out of these things. I can also prescribe things like herbs and nutritional supplements to help support the body while they're going through with whatever treatment they're going through. I talked to a couple cancer cases this last week. One of them had a hacking cough. The first veterinarian, it was brought up to the regular veterinarian that saw the dog, and she said, "Oh, it's probably just allergies." The cough continued. The next time she went into the clinic, she told them, "The cough is still continuing. What do I do about it?" She said, "Oh, well, we found this tumor in your dog's bladder, and the cough is probably metastasis and spread of the cancer, and so your dog probably doesn't have a long time to live." Now, she made that basis without even getting X-rays. Actually, no, they did do X-rays. And then she said it's probably metastasis. Well, the type of cancer this dog has, I just clued in. I'm like, that's kind of a rare cancer to metastasize as at an early state. Something didn't make sense with me. So I said, you need to get in to see the oncologist, but when you do, you need to make sure they do another set of lung x-rays, they do another ultrasound, and they stage this tumor and really diagnose it. Well, she called me from the oncologist's office and they did lung x-rays. It turns out the hacking cough that the dog had was from the visit to the emergency room where they'd found blood in the urine. The dog had picked up kennel cough, but because it had not been treated for 2 weeks and the dog was already weak with some other things going on, the kennel cough had turned into full-blown pneumonia, and he had a collapsed lung in his chest. So the oncologist was like, "We have to treat this pneumonia before we can even deal with cancer or do anything else." So, um, these are the types of things that I am seeing cross my path, and it's really frustrating sometimes. I try to get them, she did get in to see a good oncologist, and they are on the right path. They actually found some other things that are going on that were never diagnosed, unfortunately. But at least she's getting to the matter. Sometimes things aren't being diagnosed, or animals aren't being treated appropriately, and then they're dying at home, and then the people, you're like, your dog dies in front of you and you have no idea even what's going on with them. So dig deeper. Again, I am available for this is kind of where my practice is shifting into. I'm still doing house calls, but I am doing second opinion consults and just coaching and helping people find their way through the medical system of what has become of veterinary medicine. So, and the other thing I wanted to say, I'm kind of a multiple purpose thing. I've had a beautiful online community that has really developed and transformed into this awesome group of women who we're all animal lovers. And I'm the type of person that dives pretty deep into things. So, this year, every spring, I shift and start a new year-long program. I am going to be working on a lecture series that I'm going to be doing at the American Holistic Veterinary Medical Association, and I've got some teaching engagements coming up spread around the country. So take a look out for that, because you might be able to come and see me live. But I am teaching on the 5 elements of Chinese medicine and how to use Chinese medicine as a preventative wellness program for our dogs. Chinese medicine was the first functional medicine. It was the first preventative medicine. It was the first longevity medicine, and it's thousands and thousands of years old. I'm going back into the classics and pulling out these treasure trove of information that we can use to help our dogs and maybe even ourselves live a longer, fuller, healthier life. And so that's what my book is going to be on, and that's what I'm going to be teaching on. So my online program, I'm cutting that back a little bit, but I have decided to return to following the cycles of the moon and the sun through the year. So it will be, we will meet twice a month for the new moon, where will set our intentions. And then at the full moon, we will have a culmination and we will either have guest speakers. I will teach on something. One of the members of the group will teach on something and share some of their knowledge. But over the years, when I have followed the moon cycles, because there's a new moon and a full moon, that are really the original months of the year. And there's 13 new moon cycles and 13 full moon cycles, right? New moon to full moon. And the original Chinese calendar was based upon the lunar calendar, as well as celebrating the solar months. The Celtic, the original ancient European calendar, was also based on the lunar months following the 8 solar holidays. So people that lived on the earth long before other things came into effect, kind of like when I was talking with veterinary medicine, followed the lunar cycles, because the lunar cycles give us clues as to planting and plants and what to plan for coming up, what to prepare our bodies for to get us through more difficult weather and more difficult temperatures and climate factors. We have become so divorced from all that. We just think climate change is going to kill us all. No, we need to step back and we need to go back to what our forefathers followed and learn about climate and live according to the months and the climates and the energies of the seasons. And then we will get in tune with it and we won't be divorced from it, and we can live along with it and we can plan accordingly. Our animals naturally do that. Our animals have natural biological clocks. And anybody who just went through the time change with their dog knows that our dogs and cats still think our time to eat was an hour ago, right? So, we're gonna be doing that. It's gonna be a little bit less expensive of a program. You can start it at any time, but I would highly recommend, if you're interested in working with me and just joining a gathering twice a month. I usually do it in the evenings because that's when my schedule is most available, and to gather together with other animal lovers and just explore living more in tune with the earth and with our natural weather cycles. And we'll talk about diet, we'll talk about herbal medicine, we'll talk about things that we can do to connect more deeply into Mother Earth, and talk about the signs our animals are giving us, so that, because they're already connected, it's just we need to start opening our eyes and ears and listening to them to be more connected ourselves. So that's the plan. So I'll be putting announcements out here on Facebook, and I'll be putting announcements out on Substack. And if, I would love to have anybody join us. You can also join us for a few months. If it's not something you're interested in, you can always, quit. So you do get a discount if you pay ahead of time for the full 12 months. So if you're interested, I would love to see you there. Some of you guys I already see. I'm going to be seeing Ruth in person this next week. And Randy, it's good to see you. I miss you from the Dharma Center. So anyways, it's Saturday morning. I need to head down to the farm to pick up my community supported agriculture organic veggies, which our growing season, unfortunately, here is going to be coming to an end next month, which is always depressing. But while you guys up north are going to start planting seeds, our growing season is finishing up. So, have a great weekend, everybody. Get outside. It's gorgeous. Take your dog for a walk. Go do something fun. We have the ocean nearby. I haven't visited for a while. I may sneak over there and just sit and listen to the waves roll in. So take care and follow, send me a message if you want to have any questions or anything else, and we'll hopefully see you next weekend. Take care. Bye bye.